Following any significant amount of weight loss, it's important to appreciate that the physiology of your skin, your body, and its impact on recovery from surgery and wound healing is significant. Even if you've got back down to what would be considered a normal BMI, the fact that your skin has been overstretched and now relaxed means that some of its healing ability will have been affected. And this can have an impact on infection rates, it can have an impact on your future scarring, and it can have an impact on delayed healing and areas of slight wound breakdown. So as long as you understand that's part and parcel of your situation, then it's much easier to cope with any issues that might happen and to understand that they are something that are a factor for everyone in this sort of situation. Typical issues that may occur with wounds if you are recovering from post-massive weight loss surgery include areas of slight wound breakdown. These might need antibiotics, they might need dressings, and sometimes the dressings can be quite prolonged. They can go on for 6 weeks, sometimes even for 3 months. Hopefully these are in very small, discrete areas, but sometimes they can affect larger areas. But as long as they're treated appropriately, you have the right balanced diet and you adhere to other instructions given, then they really should heal without any significant problem. Sometimes, however, if there is a problem with wound healing to such an extent, we may need to go back to the operating theatre to either wash the wound out, clean out any infection, maybe remove any dead material or bits of suture if they are part of the cause of the problem of the delay for wound healing. Probably the most common procedure performed on my patients after weight loss is a form of tummy tuck. Precisely what form that takes is very variable between different individuals, and that relates to the degree of skin excess they have and the distribution of that skin excess. So for example, you may have come across a Fleur de Lis tummy tuck that also has an additional vertical scar, and that can be very good for people who have a lot of transverse or horizontal laxity as well as vertical laxity, i.e. it means we can narrow the person as well as reduce that height. There are other peoples in whom the laxity may extend around the sides or all the way around, in whom either a 270-degree abdominoplasty or a 360-degree all the way around abdominoplasty, also known as a belt lipectomy or lower body lift, may be a more suitable procedure. There's probably no perfect procedure, but it's figuring out what the best procedure to address your concerns will be, with a caveat that it's not uncommon for some adjustment procedures to be considered in the future if there are residual areas of laxity. A Fleur de Lis tummy tuck or Fleur de Lis abdominoplasty leaves a scar that goes up and down the middle, from about the bottom of the breastbone down to the pubic hair area, as well as the typical tummy tuck scar. This really is reserved for people who've either got a lot of skin excess in the upper abdomen, the epigastrium, or have a lot of transverse laxity, so they can pinch in and create that big ridge in the middle. And it really is a trade-off. It's a trade-off of accepting that vertical scar that's in addition to the normal tummy tuck scar, which is of course then more visible, with the improvement of having a better shape and dealing with the excess laxity. And that's a very personal decision and something it's important to consider before agreeing on either procedure. A 360-degree abdominoplasty, also known as a belt lipectomy or lower body lift, involves a scar a bit like a belt going all the way around, kept very low around the front. It goes a little bit higher on the sides inevitably and has a gentle M shape often around the buttocks with the lowest point in the buttock crease in the natal cleft. And this is really an excellent procedure for people who have deflated a lot, have got a lot of skin laxity at the sides and also around their buttocks, and it does enable the incorporation of a buttock lift in addition to the skin excess removal, which will enable me to reshape the bottom as well as reduce the excess skin. So it's an ideal procedure for people with skin excess all the way around. A purse string buttock lift is a procedure that can be done either on its own or as part of a total lower body lift. And it involves skin being removed from the top of the bottom or buttocks, but instead of the tissue also being thrown away, the deeper tissue is kept intact. And by some very clever manipulation of that deep tissue, I can change the shape of the flat tissue into one that's much more three-dimensional and projecting and almost spherical. So it's an auto-augmentation technique, which means we are using your own tissue to augment or simulate an implant to enable the projection and shape of the buttocks to be significantly improved, as opposed to simply excising the tissue and stitching it up, which may flatten the buttock shape and not improve the contour in 3 dimensions in a satisfactory way. An arm lift is also known as a brachioplasty, and it leaves a scar that runs just along the inside towards the back of the arm, and I usually take the scar down into the armpit a little bit because I think that helps not only define the armpit shape better, but also addresses some of the laxity to the lateral chest wall that you may have. It's a procedure normally done as a day case procedure in and out of hospital on the same day, involving a combination of liposuction to help free up and relax the skin, as well as skin excision and then stitches very carefully being placed to rebuild and reconstitute the shape of the arm. A thigh lift is a procedure that normally involves a scar on the inside of the thigh, a bit like the seam on a pair of trousers, extending from the knee up into the groin, sometimes with an additional scar that may extend slightly towards the buttocks. This is an excellent procedure for recontouring and reshaping the thighs, particularly the upper thighs. And the length of the scar will vary on different people depending on their distribution of skin excess and skin laxity. It's a much more comprehensive procedure than any short scar procedure, which is an attractive and appealing name, but actually the short scar in the groin doesn't satisfactorily address a lot of the skin excess and carries with it a degree of risk that is separate and in addition to a long vertical scar. So whilst a vertical scar is perhaps means it's a bigger consideration to go ahead with that sort of operation, I think the results are much more reliable and predictable in that way. Typical complications after any weight loss surgery often revolve around wound healing challenges such as delayed healing and also wound infections. In addition to these complications, we've got to consider the quality of scars, we've got to consider seroma or fluid buildup that may need draining off in clinic. There can be issues with DVT and PE, so deep vein thromboses and pulmonary emboli, so we're very cautious about how we reduce risk of blood clots developing for those reasons. It's not uncommon that revision surgery and adjustments may be required because of the poor quality of the soft tissues in a lot of people who've lost weight, meaning that they don't always behave and settle down in an entirely predictable way. Revision surgery after post-massive weight loss surgery is not uncommon. It's due to a degree, the unpredictability of how the soft tissues are going to behave, but really compounded by the fact that most people who have lost a lot of weight have a reduced elasticity and therefore predictability with their soft tissues. A lot of the time, these revisions might be at further cost, and that's really important to bear in mind when you're considering embarking on your surgical journey. But we will discuss those at each consultation. Quite frequently, if you're having more than one procedure done over a staged period, we would plan it so that final operation could incorporate not only a main procedure, but also any adjustments that might be needed from previous surgery.